this video, we'll be talking about the management of neurogenic orthostatic hypotension.
The main principle of management of neurogenic orthostatic hypotension is education also. Education. The patient has to know his or her self, and you can't tell from symptoms. The only way to tell if you have hypotension is to measure the blood pressure. And the people have to learn to measure their blood pressure. They have to recognize the symptoms that fit with orthostatic hypotension, such as the coat hanger phenomenon, clouded thinking when the person is standing up, overt fainting in a patient with neurogenic orthostatic hypotension is rare. It can happen, but usually people know something, they know what's going on. It happens every time they get up, and so they try to lie down. People with neurogenic orthostatic hypotension are worst in the morning. Because they're worst in the morning, they should be taking their hot shower at night, not in the morning. Because of postprandial hypotension, I told you about the Miami Chinese restaurant syndrome. Because of the postprandial hypotension, people with neurogenic orthostatic hypotension should be taking frequent, small, snack-like meals. In people with neurogenic orthostatic hypotension, the bathroom is a dangerous place. I knew two people who had pure autonomic failure who died in the bathroom. They died in the bathroom because they're straining, they're sitting still, they're having these Valsalva maneuvers. The blood pressure is just going down, down, down. And one of them actually was in a restaurant when this happened. It was for his 60th birthday. In men, don't pee standing up if you have neurogenic orthostatic hypotension. I made that sign. You're not going to see it anywhere else. It's important to recognize the difference between hypotension during exercise and hypotension after exercise. Neurogenic orthostatic hypotension, you're talking about hypotension after exercise. If the person has hypotension during exercise, that's something else. And that has to be worked up. Anti-gravity muscle training just means that, remember the pretzel leg sign, if you have great muscle tone in your backside, your thighs and calves, you'll be able to muscle pump more efficiently, get the blood up towards the chest. People with neurogenic orthostatic hypotension ought to have the medical alert band, and in the person's wallet there'll be a piece of paper that says, I have neurogenic orthostatic hypotension. It's important in people with neurogenic orthostatic hypotension to elevate the head of the bed. This decreases the shock of getting out of bed in the morning. Overnight, in a patient with neurogenic orthostatic hypotension, often the blood pressure is too high, and the brain says, "I don't need all this blood pressure. I'm going to turn that blood into urine," and that's typically why healthy people, they have to pee when they wake up in the morning. It's just part of life. The brain has translated blood volume into urine. And somebody with neurogenic orthostatic hypotension, they have pressure natriuresis, and when they have their high blood pressure at night, they lose sodium and water in the urine. That's why the blood pressure is lowest in the morning, I think, or the orthostatic hypotension is worst. And you can kind of minimize that shock by just simply elevating the head of the bed. Jens Jordan discovered that drinking 16 ounces of water will raise the blood pressure within about 15 minutes, and it can last for an hour. Very handy to know. We're not talking about Gatorade, just water. This actually is from Jens's work, showing the pretty substantial increase in blood pressure after drinking 16 ounces of water. This is in people who have neurogenic orthostatic hypotension. The very last part of this is drugs. Remember I mentioned that finding denervation supersensitivity, I think, is important. But there are risks to treating neurogenic orthostatic hypotension with alpha adrenoceptor agonists. One is, in a man anyway, the symptoms of prostatism can be worse. And you can have acute urinary retention that's very, very nasty.
Drugs are stupid. Well, let me explain. A drug is not going to know what posture you're in. And if you're taking a pressor agent to raise your blood pressure when you're standing up, that drug is still going to be working when you're lying down, and the drug could cause an excessive increase in blood pressure when you're lying down.
Mesenteric ischemia is kind of straightforward in somebody who's got atherosclerosis of blood vessels to the gut. An acute vasoconstriction could precipitate a disaster in terms of mesenteric ischemia and infarction. I want to talk a little bit about Midodrine. Midodrine is still approved as an orally acting alpha adrenoceptor agonist. All right, here is one of your quiz questions. Midodrine stimulates norepinephrine receptors. Is Midodrine a catechol? No, it's not a catechol. It looks very much like phenylephrine. Phenylephrine is a classic. It's neosynephrine, or the old-fashioned short-acting neosynephrine. It's an alpha adrenoceptor agonist. Is phenylephrine a catechol? No. Now suppose I were to make this a catechol. What is that? It's adrenaline. So somehow adding that hydroxyl group there, somehow it turns an alpha adrenoceptor agonist into adrenaline, which is a non-selective alpha and beta adrenoceptor agonist. It's kind of cool. Anyway, Midodrine is an alpha adrenoceptor agonist. It's analogous to phenylephrine. I think you can see that. I don't know what Midodrine would be if it were a catechol. Somebody must have looked into that. Florinef is Fludrocortisone. It's a salt-retaining steroid. It forces the kidneys to retain salt and water. It looks very much like the salt-retaining steroid of the body, aldosterone. Aldosterone is the main salt-retaining hormone of the body. And Florinef forces your kidneys to retain salt and water. That's why, so it'll increase blood volume, at least that's the theory, and then that'll increase blood pressure. Actually, nobody knows whether Florinef, whether the increase in blood pressure with Florinef, given long-term, is a result of an increase in blood volume. It could very well be it's not, and instead the Florinef causes salt and water retention in the walls of blood vessels and sort of waterlogs the blood vessels, and then the lumen of the blood vessels gets smaller and the peripheral resistance goes up instead of the blood volume and cardiac output going up. Florinef is a salt-retaining steroid. That means it's trading off sodium for potassium. That means you have to kind of monitor serum electrolytes every once in a while to make sure the person isn't becoming hypokalemic. Also, in order for Florinef to work, you have to be in a high-salt diet. It would be schizophrenic to treat somebody with Florinef and a diuretic for edema. But it's done. Really, it's crazy. So when you put somebody on Florinef and a high-salt diet, you say the drug is working if you gain weight, gain fluid weight. So we want to see if you're taking in enough salt for the Florinef to work. Acetylcholinesterase inhibitors are sort of used, I think, less commonly nowadays. The brand name would be Mestinon. This is something that Philip Lowe at Mayo and his group developed. The concept is pretty simple. If there are nicotinic cholinergic receptors involved in all ganglionic transmission, where is that here? Then if you block the metabolism of acetylcholine by having an acetylcholinesterase inhibitor, you're going to deliver more acetylcholine to the nicotinic receptors. You're going to increase ganglionic transmission. And partly because of the norepinephrine that's released, you'll increase the blood pressure. It's much more complex than that, and but that's the idea. The last drug I'll talk about is L-DOPS, or Northera, which is marketed by Lundbeck. L-DOPS and L-DOPA are very similar. L-DOPS gets turned into norepinephrine, and L-DOPA gets turned into dopamine by way of this enzyme, L-aromatic amino acid decarboxylase, or dopa decarboxylase. Is L-DOPS a catechol? Yes, L-DOPS is a catechol. What about DOPA? Is DOPA a catechol? Yeah, they're all of these are catechols.